I am delighted to introduce the speaker of this webinar, Dr. Laura Funk, who was the recipient of the CAG Excellence in Research on Unpaid Caregiving in honor of Nina Chappell, and she received that award in 2019. Dr. Funk is a sociologist and social gerontologist, and she's an associate professor at the University of Manitoba. So with that, I will turn the microphone over to Laura.
Great, thank you, Verena, and thanks everyone for joining in today. So today my goal is to provide you with an overview of my research on family caregiving and sister navigation, and especially to position this in relation to the larger body of research that's emerging in this field, and then I look forward to having an engaging discussion as well after the presentation. So the root or core of my interest in this topic is to explore family care work at the intersection between formal systems and services. I'm also interested in sort of developing broader understandings of caregiver burden, and so the term structural burden used here has been referred to in an article by Taylor and Quinnell Vallée. I've got that in the references at the end, and it refers to kind of a distinct and important form of burden stemming from caregivers' work in managing complex interactions with fragmented structures of formal health and social care systems. So in this presentation today, I'll connect carers' navigational work to their experiences and potentially to burden, and this is really a starting point for future research on outcomes of navigational work. And by navigational work, I'm referring, I'll explain a bit more, but I'm referring to sort of how people figure out how to access formal services, resources, supplies, both across and within sectors. The work they do as well, coordinating and managing to help ensure that needs are met. Oops. Just trying to toggle here. Hold on, there we go. So from how I see it, at least, I think this is an increasingly salient issue, not just for older adults and for caregivers, but sort of across the board and anyone that's trying to access formal health and social care services. But when we're thinking of this in relation to older adults and families, why might this be? Part of this might be about a context of sort of this might signal some insufficient outreach to help families connect to resources, and part of this might be about the shift to home and community-based settings, the sort of quick pace of transitions, particularly from hospitals to home, as well as things like high staff turnover or the erosion of time for staff to do navigational aspects of their positions. It might also reflect insufficient culturally responsive services to meet the needs of a changing population. And the other reasons I think that this is still or becoming an increasing issue is that there's really the persistence of assumptions like in terms of information that one size fits all, or as Nicole Dahmer highlights, it's sort of this assumption that you add information and stir, and that's sort of not really seen as more complex. And the other problem here is we have often an ever-changing service context with implications for the information as well. You could maybe position this in relation to the sort of caregiver crunch or crisis in which caregivers are feeling perhaps less time and increasingly pulled between multiple responsibilities and demands. There's a really good book called Administrative Burden, in which this kind of issue around gatekeeping and convoluted application procedures in particular is positioned as a kind of policy making by other means. So I've got that reference at the end of the talk as well. And then I've seen both arguments here that sometimes this issue of the problems navigating systems, some people position as arising because there's simply more services and supports available. And then I've also seen it argued that it might also arise because there's actually a problem of or an erosion of appropriate services. And in that respect, Anderson and Lark have referred to this problem of kind of, well, navigation to nowhere and increasing eligibility criteria and those sorts of things might be part of the issue. And I wanted to also flag that there's a lot of existing concepts out there and emerging ones that could apply to this issue in some way. So certainly some of the work on access to care more broadly, patient navigation that I'll refer to later, even the idea of cultural brokering. More recently, we've seen terms emerge like system navigation, which was used by Manderson and colleagues specifically to refer to the issue with older adults. And then there's a book out that I'll mention again towards the end called Service Navigation, and I think it's Health and Human Services. But there's also some interesting ways in which these other concepts, the candidacy model has been used by Sharon Cohen to refer to how ethnocultural minority older adults access services. The linkage processes idea was put forward by Carpentier and Grenier in an article in which they talked about sort of how formal and informal actors link up and the complexity of that process. You could also perhaps see tie-ins to concepts of health literacy. I've seen navigational capital also in the literature, and older terms of care management, which sometimes are a bit broader. I think that refers to and includes coordination of family care. And then information work has been sort of revisited as a concept more recently by Nicole Dallmer, and is also relevant here. But just as a quick snapshot of some recent research emerging on this, I found at least 10 articles in Canada, qualitative articles addressing this issue, and then about 7 from either the US or the UK. And these were all qualitative pieces, and from about 2000 onwards, and particularly more so in recent years, I've seen more and more of this. And of course, we need to continue to look more broadly at how older adults themselves navigate services and what that literature says, as well as navigation among persons with various needs for care and other kinds of chronic conditions as well. But the overview I'm going to provide here is just based on this more narrow snapshot. So in these few studies I identified, which appear to be more common in the recent years, navigation emerged as a key theme in a broader study, or the focus of the article was specifically on navigation. And I think we could safely say with some of this research positions navigation, particularly navigation challenges, as a core theme of contemporary family care. And highlights this as an issue that is sometimes even potentially more emotionally difficult than direct care provision, especially for families of older adults with multiple chronic and/or progressive conditions. I think we can also say that this spans across the care continuum, although might be especially salient at transitions. That some of the research out there suggests this really hinges on carer abilities and learning. That's a learning curve for them. It's also identified as almost universally highly stressful for some caregivers more than others, but for me, this signals that it may be an important aspect of care burden. And then along with that stress, that sense of frustration that carers often express with systems that they view as problematic. What do we still need to know? Equity issues, so older adults with and without family carers. How does navigation, how is it different for those of more marginalized social locations and backgrounds? We need to just generally better understand how carers are doing this work, and how structural features of existing formal services and systems influence the need for, experience, and potential outcomes of navigation work by carers. And this is not just within healthcare as well, that a lot of the research focuses on that context, but we can think here quite broadly of all kinds of social care and other kinds of supports. So the research I'll summarize here was part of an establishment grant that was over 5 years. I think there was 2 parental leaves in there. And the first core piece of this that I'll focus on was to explore how family and friend carers experience navigation through systems, organizations, and bureaucracy. So these were qualitative in-person interviews over time. So we did we aimed to complete at least 2 interviews with everyone, and in some cases the older adult had died before time 2. And then for some of the individuals, they had a time 3 interview, especially if there were some changes that they wanted to talk about at the follow-up point. So I'll talk more about that in a minute. And then I'll also talk briefly about a second component in which we interviewed formal navigators to look more at kind of the work they do and their interpretations of that work. And that was also through qualitative interviews as well. And then more recently, I compiled and synthesized some of this work and extended it to kind of discuss this issue of how do we best address navigational burdens by family caregivers. So in terms of the first component, this is just a really quick overview of the participants of the study. They were recruited from Winnipeg that's way back in 2014, 2015. The interviews asked them to explore their kind of what navigational work they did and their experiences of that. The average length of the interview was about 1.5 hours. Obviously most were female, and I'll just put the rest of these up there for you to have a look at. But the important thing I think here to flag is that in terms of who we were able to recruit, most participants were generally, you might consider them generally well-equipped to navigate systems. Most had extensive sort of social capital and material resources, health literacy. Many of them worked within the system in some form as well. So that's important to consider when addressing the interpretations of the findings. In terms of the analysis, myself and my research assistants paid close analytic attention to structural sort of precursors of navigational work, and then the strategies they did and their experiences of that work, and then we also extended that to think about consequences, both what was directly identified by participants as well as our own interpretations. And that did lead to the following paper, which the full reference is available at the end if you want to dig into them for the quotes and specific examples. I'm not going to focus a lot on quotes in the presentation just for the interest of time, but there's some really, especially since many of the quotes for these for system navigation I find tend to be very lengthy because this is such a complex and overwhelming and very detailed sort of work. It reflects the nature of the work in many ways. But just as a summary of that first article, in terms of the navigational work that we identified, we found that caregivers spend a fair bit of time doing what we call just navigating the mystery, which is the digging and hunting for service information, resource information, trying to find what was available out there, and then finding that information, like how do you access it? And they referred to this in kind of the work they did digging or hunting for information. The sort of antecedent conditions to this are context of rather sometimes poor transparency or information about services, resources or supplies, maybe this lack of outreach, and some of the consequences in terms of how caregivers experience this. They often reported feeling lost and abandoned, wishing they had known some key information sooner, and then some people simply didn't access services. If they didn't know what questions to ask or who to ask, then they could be at a disadvantage. Another core piece of this is right down to the point of trying to actually, now that you know some services exist, how do you get them and get them in place? And the caregivers refer to this often using this kind of metaphors of pushing through, or I think often the fighting and battling sort of terminology came up there as well. And then occasionally this idea of kind of working around the system, how to kind of find that loophole perhaps to ensure that they can access the services or supports for the older adult. And so the antecedent conditions to this work are sometimes providers acting as gatekeepers, challenging application processes, long waiting periods, convoluted or problematic assessments, sort of aspects of bureaucracy, and that sort of thing. In terms of the consequences, caregivers talked about this primarily using the word frustration. They spoke of this work taking a tremendous amount of time and emotional energy. Some would give up at this stage too. Many persisted, but you can also see how this would lead to potential inequities in terms of who was able to kind of push through as well. And then even once accessing services, I think we can extend this idea of navigation to look at how caregivers do the work of navigating a very fragmented system. And so this is that piece of pulling or piecing together different services and supports from different sectors and areas, the coordination and oversight work that they do. And the antecedents here lie obviously in the fragmentation and maybe lack of formal coordination mechanisms. that many of these caregivers do not have access to. Potentially also a lack of trust in the system, which many caregivers started off trusting the system, but then had experiences that led them to not trust the system, experiences with poor quality care, and that just heightened their feeling of needing to do some of this work and making sure that mistakes were not made. Obviously, in terms of consequences, the time and energy involved in this was referred to. Some caregivers would give up on certain things. So in terms of if it was too difficult, for instance, to submit some receipts for reimbursement, even just that process, they might not do it. Or this could even lead some to, for instance, give up on home care altogether for informal services. And you can also see how this piece too might lead to potential inequities. And as a summary of some of the key findings from that piece, we really wanted to highlight how the features of formal services were what were shaping the need for and the difficulty of navigation, and highlighting how navigation work does not stop after services are accessed. So it's not just an issue of sort of access to care, but sort of that ongoing piece to kind of link and pull everything together along the way. In terms of how we can begin to conceptualize the effects of this work, I think some of the key pathways would be the, first of all, the time and energy that this work requires. It takes time away from caregivers' other work that they do, and that they often didn't view themselves as being responsible for navigational work. They would much rather be devoting their time supporting the older adult more directly. Another key pathway here would be the emotions, and I'll talk to that in a minute a bit more. The emotion work that this work requires or can require. And then more indirectly, though, we also have to think about how sort of the success, if you will, of navigational work might shape service pathways of older adults and the outcomes for older adults and carers, the amounts and aspects of work that carers have to do. So we in that article, we argued for the sort of broader conceptualization of care burden, drawing on Taylor and Quinnell-Vallée's concept of structural burden, and maybe thinking about, can we begin to look at this as maybe a long-term process over caregiving careers as well, and with potential long-term implications. And then the second article that we published from this highlighted this emotional piece that I want to talk a bit more about, the emotional sort of pathway. So recognizing that emotions actually infuse navigational work, just as it probably does other aspects of caregiving work as well, but this might be a key pathway for how navigational work can affect and shape caregiver burden. And it's important, though, to conceptually distinguish between two aspects of this sort of these emotional pathways. And one is simply that the nature of the emotional responses to navigation-related stressors. So these things that we talked about earlier, the feeling lost and confused, which happens more often earlier on in the process. Periods of acute distress when you can't help the older adult access something. The feelings of worry and particularly guilt for caregivers who later learned about a resource that they could have accessed sooner that might have prevented a situation from happening, and those sorts of outcomes. Frustration, as mentioned earlier as well. Even the sort of dismay and shock in the system. So those emotions themselves in relation and responses to stressors could be very important, and are obviously tied to the sense of responsibility that the caregivers have for the older adult and their perceptions of the system. Over time, however, with some of the participants, we found that sort of this, getting to a place of maybe achieving some, if you want to call it, mastery about navigational work after some repeated successes could, with some caregivers, generate a sense of pride or confidence in their ability to do this. But what was interesting was even if they expressed those sorts of sentiments and a strong desire to help others and use their knowledge to help others, it didn't necessarily reduce the resentment and frustration they felt over having to do this work and over the challenges that they had faced along the way. The second piece I want to draw out here, though, is slightly different, and this is the emotion work component of navigation. So this is the idea that that we all sort of seek to align ourselves with normative expectations of feelings, sometimes suppressing more negative emotions and invoking positive ones. And this is a fundamental aspect of family caregiving more broadly. And we can think about how navigational experiences might intersect with this kind of generalized emotion work of caregiving in certain ways. So I'm thinking in one example of a caregiving granddaughter who kept emphasizing in her interview that she didn't want to become a person who was embittered by caregiving. And in some ways, the challenges she faced with navigation in particular contributed to this sense of sometimes feeling really bitter, not towards the care recipient, but just bitter about the situation that she was in, and she didn't want to feel like that. And I think a key part of this too is that interacting with formal professionals in doing navigation requires a fairly extensive amount of emotion work, and in particular to maybe suppress feelings of frustration and anger in those interactions, primarily in a context of a fear of reprisal. Should you sort of become seen as that complaining family caregiver kind of thing, but also just knowing that, the idea that you get more, is it the saying, you get more flies with honey kind of idea. But what was interesting was that some caregivers also emphasize that in fact you need to have some level of anger to effectively advocate. And so it's sort of becoming angry as part of it, but then bounding that anger in some way. And so I think that's an important aspect of emotion work that also could be further studied. So in terms of how we can address system navigation challenges, so those questions obviously stemmed from some of this work. And we know that the onus is currently on older adults and families to do this work in most cases, and it can generate inequities and potentially structural burden. I think that, and I've argued subsequently, that we need to recognize navigational work as a public issue, not necessarily a private trouble or responsibility. And in the IRPP report that I'll mention again later, we talked about aspects of, you could potentially improve the information that's available out there. That may be one sort of route to take, but probably not on its own, sort of not sufficient. I'll talk in a minute about the idea of formal system navigators. And then more broadly, though, we can also think about, making systems more coordinated, more integrated, less fragmented, more friendly towards those who use the system. So our next step in the project was to look at some of that research on we started with patient navigators, with this idea of thinking about, well, what about people who are in the formal system who do some of this work or could do some of this work more? So some of you might be familiar with some of this research, obviously, that the concept of patient navigation was originally a formal program or intervention for cancer patients that was specifically designed to eliminating, I think, racial and ethnic and socioeconomic barriers to accessing care. So it was really around that original goal of reducing inequities of access to cancer care. Since then, the concept has had growing popularity and expanded into other sectors, for instance, with the Manderson article arguing that this could be used with older adults. But yet we still see that the programs tend to be used in a very disease-specific or setting-specific, maybe transition-specific sort of way. So in very sort of limited scopes. The literature generally defines patient navigators as providing information, brokering access to health services, and alleviating barriers in marginalized populations. And some evidence does suggest that those positions can be beneficial, so the evaluations that are out there. Primarily, these are looking at patient outcomes, remember. And as this concept has diffused through these various sectors, though, there seems to be little consensus about that contemporary scope of the navigator role. So sometimes you see it as positions that involve sort of advocacy, and other times much more passive forms of navigational supports. And there may also be, I've seen also some variations in terms of whether the navigator positions were what we'd call patient-centered or whether they were more system-centered in design. There's been some interest in lay and volunteer options. They're a little problematic, but those are also something that people looked into. And then we also have to acknowledge that aside from just formal navigators or patient navigators, that navigation support is also sometimes the formal or informal role of other professionals in the system, even as some of them might express that they have less time to be able to do that piece of their work. And then there's also privately paid case managers out there doing some of this work for more well-resourced families. So since there might be, I believe there's going to be increasing emphasis on formal navigational supports in the future, so we need to better understand who's doing this work in both medical but also non-medical sectors as well. And we need to know about how these professionals experience their work and interpret the meaning of their role, the meaning of system navigation, because those interpretations may inform their work that they do, in this case with families and older adults. So that led to, and our interest in this led to our study of sort of who is doing this work in Winnipeg, and to talk to them a little bit about their understandings of what they do. So how do service providers act as system navigators for families of older adults, and how do they interpret their roles? We talked to or recruited 3 general types of what we call formal service providers or system navigators, and these were 3 groups, there we go. These are people who sort of self-define navigation as a substantial part of their paid position. So obviously a lot of these were health authority employees. We have some designated navigators in certain areas here, but also social workers, home care case coordinators would also consider themselves as doing a lot of navigational support. We also spoke with 8 employees of local nonprofit agencies that served older adults and their carers, executive directors, for instance, or client support and therapy coordinators, that sort of thing. And then we did talk to 3 private navigation consultants who were working independently in the community. Average length of those interviews was a little bit shorter. And then, as well as talking to them about the sort of the nature of the work that they were doing, in the analysis of this data, we'd asked participants to talk about barriers that they felt that families faced accessing services, and their suggestions for change or improvement. And in our analysis of these, we drew a little bit more on an interpretive approach that sought some of the sort of implicit information that they were providing us about their interpretations and meanings of system navigation within their responses. So that might become clearer in a minute here when I present the findings from that piece. So that was a publication that, again, it's cited further down at the end. In terms of their role interpretations, most of the participants framed what they did as targeting individual level barriers such as knowledge, skills, and dispositions. And most framed themselves as providing support during key transitions or crises, or when asked, as opposed to a more proactive approach. Many participants acknowledged they could not address what some of them saw as a problem of insufficient resources. And for those participants that did feel this way, they expressed a sense of powerlessness or distress, that they could not do this. Health authority navigators in particular emphasized their navigational work as involving sometimes coaching families towards particular options and solutions, and also the idea of supporting organizational goals. And so that latter piece is more about talk about how their work was also about activating families to provide more care, ensuring the smooth flow of patients out of hospitals, and even in some cases the idea of lowering families' expectations about what they could access. And what was interesting here was when we spoke with say some of the nonprofit providers, that there was one agency that actually explicitly said, you know, being outside of the health system actually helps us to objectively give information to families. They were of the opinion that public navigators can face pressures to conserve resources, and that this might limit their ability to sort of have that more patient or family-centered approach. There was less emphasis among the participants on taking a very active role in helping with navigation and hands-on role. So in the States, some of what I'd been reading was this idea that a navigator could even help families fill out application forms and do some of that work actually for them. And there was far less emphasis on that here, or on the idea of advocacy, with the exception of the paid consultants, who emphasize this as kind of a core piece of what they do. And even though there was less emphasis on this work, many participants emphasized that they wanted to do more of this, but just did not have the time for help to be able to help everyone. And that maybe if they did this, it was more a case-by-case basis rather than for everybody. And then the notable silence in the data was that no navigator explicitly defined the role as about addressing structural inequities in access to services. And some even dismissed that possibility, emphasizing that the problems were primarily at the individual level or kind of across the board, even as they talked about things like the backgrounds of the culture and education and so on. These were primarily framed as individual barriers. So there was that sort of only rarely the acknowledgement of sort of broader systemic or structural issues, creating navigational challenges. The things I wanted to flag here were that many participants emphasized how their own professional backgrounds and specialized experiences made them very well suited to provide navigational help, and yet even at the same time, for some of them, they mentioned it was even difficult for them to figure out the system. And in terms of how we interpreted some of these results, I mean, part of this, I think, is about how many participants' job descriptions might have included other aspects as well. And so it might have been, the navigational piece might be quite constrained. And so limitations in job descriptions, particularly a lack of time and heavy workload constraints, meant that they really didn't have a lot of extra time to do some of the advocacy, for instance, or hands-on work. And I think this is intertwined with obviously broader assumptions of individual and family responsibility, but these are sort of reinforcing each other, so that particularly in situations where professionals are constrained in their ability to effectively help, they might inadvertently kind of recycle that interpretation of the problem as a private trouble of individuals and families. Subsequently, or after those publications, I worked to sort of synthesize some of those findings and did some in-depth reviews of the literature for this IRPP report, which focused on presenting and discussing differing policy responses and options. And so this is what I alluded to earlier around this idea of, a three-pronged approach could involve providing some improved information, expanding navigational support programs and positions within the formal system. As I mentioned, they're currently only available in some regions in sort of a patchwork way. If we do go that route, I think they need to be clearly defined role descriptions and be resourced adequately to do navigational support work, and ideally be kind of patient or client and family centered. We might discuss some of this later, but the use of interdisciplinary teams for this could also be a possibility, again, if they have clear definitions and mandates to do that work. And then ideally, integrated care would be the best solution in my mind. The fellow I was working with, the IRPP, felt that this was probably not the most feasible solution, but I think certainly the findings from the study add to the need for that kind of work. And then in conclusion, that's it. I do want to flag sort of some promising new developments or things that we need to work towards. And one is that after publishing some of this work, I've been approached by others who are looking at this issue in other sectors. And there seems to be a need for some pan-Canadian cross-sector collaboration and leadership. So not just about older adults and family caregiving, but looking at this very, very widely and in health and social services. So sort of knowledge transfer and that sort of thing. I don't know that there's a lot of, if anyone knows of anyone sort of leading this work, that would be great to have a discussion. I've had people asking me about whether I'm planning to do more, and they talk about sort of organizing conferences and that sort of thing. But I think we also, in terms of the research, need to tease out components of what is a successful navigator support and approach, what works, why, and in what context. And then along with that, to evaluate the effects, not just on patient and client outcomes, but on caregiver burden, and on equity as well. We might look down the road at how the complexity or intensity of navigation changes or might change over time for individuals and families. And then more recently thinking about whether it's just something I put out there around whether changes related to COVID-19 have maybe impacted some of the navigation work performed by families. And then in closing, I just wanted to flag that there was a Canadian Healthcare Navigation Conference that was recently going to happen, but got cancelled because of COVID. That one, of course, though, was focused very specifically on healthcare and patient navigation. Dr. Nicole Delmer's also published some really important work recently on this idea of information work, which ties in with some of this. And I recently reviewed a text by some researchers in Australia, Davidson, Hampson, and Connolly. And so they published a text, as I mentioned, looking at service navigation across health and human services. And so I think that'll be an important text going forward. Just want to put the acknowledgements up there. And then there are, if we post the, I'm assuming we might also be posting the PDF somewhere, and there is, because there's the list of some of the references there. I am excited to discuss this further.
Okay, thanks, Laura, for this excellent presentation. I'll invite people now to put questions and comments into the chat box. And once again, if you do not see a chat box, click on that bubble on the right-hand side of your monitor. Now, let me go to the first question. Are there any programs for training formal and informal navigators in Canada?
I do not know about sort of more universalized programs. Maybe someone else on the webinar might be able to speak to that. I think my sense is that they're sort of trained quite specifically within certain sectors.
Okay, so like cancer, in the cancer field, that kind of disease-specific sector?
Yeah.
Yeah, okay. All right. In terms of, there was one comment around getting access to the reference list and so on. This webinar was recorded. It will be posted on the CAG website, and the slides will be made available there as well. So if you want to go back to some of the references, you can do so at a later time. Let me go to another comment, a question rather. Did you come across any research data where you received feedback on system navigation of dental care in long-term care in Canada?
No, but that would be a really interesting area for future research. I didn't come across any articles on that.
Yeah, and dental care is an important issue for sure, yeah. There's also, somebody made a comment that there is actually work on national navigation certification exam. Oh gosh, I had a hard time getting that out, sorry. There is work on a national navigation certification exam. Is that something you're familiar with, Laura?
No, but that'd be great. That's great to know about. Okay.
All right. There's also some reference to some other work by Mei Montori and staff.
Okay.
I don't know if you can comment on that. Gosh, that's putting you on the spot, Laura, right?
I haven't seen the burden of treatment. Yeah, I will look into that. Thank you.
Right. Here's a good one about the Public Health Agency of Canada, and I'm going to reframe this comment a bit, but what is their role? What do you think is their role in this whole issue around system navigation?
Sorry, the Public Health Agency?
Yeah.
Oh. I do not know if they're currently doing any work on it, but it would be helpful for these sort of national level organizations to help. Like, as I said, we're really seem to be needing some national level cross-provincial leadership and cross-sectoral leadership in particular. That'd be great.
Yeah, and then the question whether it's FAC or some other organization, that would be another question. So here's another question. Ooh, they're coming in fast and furiously. in terms of the comparison, and specifically, do you have any thoughts on differences and similarities between the UK and Canada?
I've only just that I've seen a fair bit of some of that qualitative work is also coming out of the UK as this, flagging this as being a problem, but I don't know whether their approach to addressing it differs substantially. So I didn't do this sort of across international sort of lit review, with the exception of, most of my literature review piece focused on the US and Canada.
And in terms of US, Canada, just as a follow-up, is there any different, are there major differences there that you saw?
Well, again, just that the, I don't know how much they've expanded this into other sectors per se, but knowing that sort of the original focus was in cancer care there, and that this was had a heavy emphasis on addressing racial disparities in access to care, I would wonder if maybe that was still the consensus might still be within the US context, perhaps oriented around that, but I'm not sure. It's a great question.
I'm going to slip in one of my questions here and it has to do with what you were suggesting in terms of needing cross-sector knowledge exchange. Are there any areas where navigation is particularly strong, you think, that we could learn from?
Well, in cancer care, I think just that, even in Winnipeg, we have cancer care navigators. So sort of starting there and then looking across maybe other sectors. I don't know, again, some of this varies by region as well, right? So yeah.
All right, okay, thanks. Another question is if you could describe integrated care a bit more.
Oh, it's not my area of expertise, so that's my caveat there, but I did see this as sort of one of the ways which might help address some of these problems, that if care was simply not so siloed, I suppose, between different sectors, with each system kind of being run in an entirely different way and having different procedures, or if there was some way in which patients or clients were sort of followed over time in a consistent way through and across settings and transitions, that might help alleviate some of this issue. So yeah, but it's sort of a full review of integrated care and what that means for navigation was sort of beyond my scope for this particular project, but we did look a little bit at the interdisciplinary teams as being a potential option, and sort of system navigation being part of that work.
All right, great, thanks. Also, just to point out, Lorraine mentioned that the college level programs for navigation are available in Ontario. So there's one of the Cambrian Colleges program in Sudbury, so that's for your information. Going to the next one, I'm going to read this one, this question by Chloe. I work as a seniors community navigator in a small rural community in BC. I'm wondering if you can comment on the advocacy role that communities play or can play, and if you have any suggestions for how to leverage the evidence that we collect with broader evidence from the research.
Leverage evidence. So the advocacy piece, so maybe I need the question repeated. To speak more a bit about the advocacy.
Commenting on the advocacy role that communities play or can play. I think this goes beyond the individual.
Yeah. I think what's interesting, and maybe this ties into one of my other interests, is in how caregivers, so many of the caregivers that we interviewed, especially those farther along the kind of continuum of care, so where the older adult was maybe now in a care facility and had transitioned there, many of them, as I said, felt a high degree of mastery over having figured all this out and finally learned it all now, and we're helping other people informally in their network, so sort of being that person in their office that people came to for advice and support about navigating the system. And some of those caregivers, I would say, almost took on that advocacy, maybe not so much an advocacy role, but they were getting there. They mentioned this idea frequently that, you know, if it was hard for me, how would this work for people who didn't even have a computer, or who weren't as well connected maybe as I was? And I think that there's a potential there to engage some of these caregivers who are farther along, or maybe even bereaved caregivers down the road who want to be involved in more kind of grassroots advocacy around this particular issue. And it may be that they want to advocate around the need for navigational supports or the need for more services, those sorts of things. But certainly navigators can, formal navigators can also do that work, but then some of them are constrained based on, you know, if they're located within a health authority, they may not feel they're able to kind of push or advocate. They might be in a nonprofit that also doesn't necessarily feel they can kind of push the boundaries a bit, and that's where some of the private navigators really saw a strength that they could do that. But again, the private navigators are only accessible to those who can afford to use them. And then there was a piece around leveraging evidence, but I wasn't sure.
Yeah, I guess that's, how would you leverage evidence into actually making changes? Mm-hmm. There's another big question for you, Laura.
Yeah, I think starting to collect information on the effects of system navigation challenges on both the pathways of the older adults or patients and the well-being of the carers.
Yeah, all right, thanks. I'll go on to the next question. You said that lay or volunteer navigation programs are problematic. Can you please elaborate a bit on that?
Yeah, I'm thinking in particular of, oh dear, now the name's going to escape me. There had been some work done I believe it was in palliative care in BC, using lay and volunteer navigators. And I mean, one of the advantages is of course that lay and volunteer might have that greater space to maybe engage in that advocacy role, and are particularly well connected to rural contexts and local contexts about what might be available. I believe in some of that research, though, they found that some of those navigators wanted to be a little bit more connected to the formal system in order to better advocate, that they sometimes, not being in the system may in fact be sometimes a disadvantage as well as an advantage. I mean, the other reason that lay or volunteer approaches might be problematic, or simply I think from a health authority perspective, for instance, that, you know, training issues or reliability issues might be a concern. And then there's simply the idea that, you know, should this be the work of volunteers, or should this be the sort of responsibility of formal systems who are creating some of these problems in the first place?
All right, thanks. Just for everybody's sake, as you can see, the chat box is filling up very quickly. So if I jumped over you, I'm sorry, I apologize. I may miss some of your comments, and but hopefully, as you're kind of listening, you can also scroll through the comments. Some are more comments. For example, we had another one that Fleming College has an online navigation program. I don't know where that is, but it does appear that there are navigation programs available. Let me go on to a question around, can you speculate, probably your research doesn't directly address this, but can you speculate on the differences, or from the literature, on the differences between what services programs are available in rural remote areas as compared to a larger center? And then I'm going to add this myself, how would that change the navigation process?
Yeah, so that, I mean, there is that issue that if services simply and resources are not as available, that becomes that problem of navigation to nowhere, and that you're kind of stuck if there really isn't much to refer people to. I'm not sure if the comment referred to sort of what navigation specific services and supports might be available, but probably very little, I would imagine, too, in some of those rural remote areas.
Mm-hmm. We're getting back to integrated care, and I realize you said that it's not directly your area of expertise, but can you just speculate on it? Question is, do you think introducing a well-integrated system at the provincial level might help decrease stressors on caregivers?
I can answer that easily. I can say yes. Yes. Ideally, I mean, it should in theory.
Yeah. So let me add a question then. Why is it, what do you think, and this is my question slipped in here again. Some of these issues, these challenges you're talking about, what are the root causes of these systemic problems? So why don't we have integrated care? Why are there so many challenges to navigate the system?
So when I was talking to, it was Colin Busby at the IRPP about some of this, because I was sort of really emphasizing the integrated care piece, and he's like, well, yeah, but how feasible is that really? Because we've been talking about it for a long time, but haven't made much progress. And I think part of the problem there is the sort of, you know, each province being responsible for its own system, right? And you know, does one province move towards integrated care and then another one cannot be something that we move forward with? I think there's very few governments that are provincial governments that are probably given their, you know, the 4-year mandates and such, that they would want to start making these huge programs that, you know, there's vested interest in different sectors and not wanting to see things change. There's huge financial sort of implications about how money flows and is run. There's probably some political barriers there to address as well. And I don't think there's a lot of public support or pressure for this, because there's not a lot of understanding about integrated care or what it would take to happen.
Okay, thanks for that. Somebody's also wondering when the navigation conference has been rescheduled to. So I'm assuming, I'm just going to throw out an idea that probably that's on the hold for now, unless somebody knows when it. So this is the navigation conference that was canceled. If anybody knows, well, next April. All right, so there we are. So to next year.
I think it's called the Healthcare Navigation Conference. It was supposed to be in Toronto.
Another question again gets us back to dental care. Did anybody mention integration of dental care in any of your research?
I didn't come across that, but I suspect if you were to look specifically for dental care and then along with like in a specific search online, you could probably locate some of that. But that would seem important as well. And I think, I mean, really, we're looking at, we need to look at a wide, the approach I took to navigation wasn't just to look at, say, access to home care, access to long-term care, but sort of access to all kinds of whatever, you know, the older adult that someone is caring for might need. And obviously dental care being a piece of that, right? And it might also be even access to things like caregiver tax credits or any kinds of more socially oriented, say, housing supports and that sort of thing. So taking sort of across a wide view would also be important. That includes all of these aspects of care.
Yeah, okay, thanks. Here's another question, and I'm just going to read the question as is. I know there are several websites in Canada that aim to help the public navigate the system. Are there any that you think are doing a particularly good job?
Mm-hmm. I haven't done an extensive review of those, but I do know that somebody from, that's not a website so much as there's also telephone, like Ontario 211. Someone had contacted me from there. And then there are websites. I know Manitoba also had a seniors resource guide. It's the problem with some of those things are they're often out of date, right? Or they don't provide, I don't know about the websites per se, but some of these don't provide even sufficient information along the lines of what caregivers would want. And so they might either, the websites themselves might be ironically hard to navigate, but also they, like for instance, some of the government information is very minimal and just tells you here's a really basic description, not sort of what kinds of people might be accessing these services and what are the eligibility criteria, what is the process, all the sorts of maybe more what we call often referred to as more tangible pieces of information. tacit pieces of information that often aren't put into print. And so caregivers would often emphasize that even if they had access to some of these sort of print-based stuff, that they often prefer to talk to someone sort of in person who maybe could and talk to them about their needs, and then have someone provide referrals or help really explain the context of services.
All right. Great, thanks. A comment more, I take it more as a comment that in terms of lack of integration, here in the UK, there is a strong policy push to integrate health and social care. Currently, health is funded centrally, our beloved national health system, and social care, home help with ADLs, is provided and paid for by small local areas. So there's a bit of a UK perspective. And let me see. I'm scrolling up. I probably missed some of the comments. I'm sorry again if I skipped through. There was some information, some web links. Just scroll up and check it out. For example, we have a link to the navigation conference, so that is great. If anybody has one last urgent question, please put it in now and I'll take it now.
And everyone can feel free to email me too if they have other things to follow up with.
Oh, we just had a comment around a seniors advocate. So BC has moved to a seniors advocate. What is your thought about having a seniors advocate, Laura?
Yes, I would like one too here in Manitoba.
Okay, all right. Okay, well, I'm gonna move to the end of this webinar now. Just a final comment. Again, thanks so much, Laura, for doing this. Very interesting presentation. And to just repeat, the webinar will be posted on the CAG website with the slides, so you can, especially the references will all be there, so you can check that out. I want to alert you that our next webinar is on May 21st, and that will be the final webinar for this season. The webinar is with Dr. Dorothy Pringle, who was awarded the CAG Distinguished Member Award in 2019. She will be talking about the current crisis in long-term care given the COVID-19 pandemic. And she hopes to explore during the webinar what our responsibility, if I can get that out, to explore what our responsibility is or should be in responding to this crisis. So I hope to see you next month, and please stay safe. I hope you're all doing well and keeping sane during this crazy time. And so long. I will be closing the webinar now.
Thank you.